Yes. Well, I understand those concerns. Anti-inflammatory treatment is a double-edged sword. I mean, all doctors have known from decades ago that steroids, which are very potent anti-inflammatory agents, are not to be used in infection. That's been the general rule. And the whole inflammatory process is linked closely to immunity, and is part of why we develop immunity, the specific immunity after a week or so, but also the innate immunity, which kicks in within minutes of an infection. And interfering with that may be problematic. So many people have researched this, and there is evidence from other viruses that other NSAIDs, then commonly ibuprofen and naproxen, may be bad for the risk of bacterial infection following a viral illness. But it's not a severe effect. It's not been sufficient to stop these drugs being available over the counter, for example. And they are also effective at symptomatic relief. And I would come back to the point that COVID lung infection is a painful and very distressing illness. And one of the reasons that Dr. Leibovitz was able to use indomethacin freely in New York was because his patients were at risk of death, and yet were having severe pain and absolutely dreadful coughing. Indeed, this is referring to some of the other actions of indomethacin in suppressing cytokine storm, which he had experience of as a nephrologist. And this is under treatment for that. So these other actions of indomethacin are worth consideration. Its antiviral actions are why it was selected by Leibovitz and Rothstein in New York. These antiviral actions were discovered in 2006 following SARS-CoV-1, when Amici and colleagues discovered that indomethacin suppresses SARS-CoV-1. Although the Leibovitz experience was published in May, there still haven't been any studies in primary care on interventions in early COVID. There are some research studies underway using other NSAIDs, that is on ibuprofen in London and on naproxen in Paris. There are 6 research studies, last time I looked, on aspirin, but only in antiplatelet doses. And it's clear from our research on bradykinin that you need a proper anti-inflammatory dose to work against bradykinin.